Hi, I'm Shayla. I research gene therapy being used with retinitis pigmentosa and related disorders. First of all, what is retinitis pigmentosa? Retinitis pigmentosa is a genetic disorder that severely impairs the patient's vision. This first picture shows a healthy retina side by side with a retina affected by retinitis pigmentosa. The cause of retinitis pigmentosa is a breakdown and loss of cells in the retina, which causes pigment clumps. This picture shows the whole eyeball. This outline right here is the retina. The retina is the part of the eye that is sensitive to light. The next picture shows a close-up of the retina. As you can see, the cells have broken down into pigment clumps. It is apparent that this retina is damaged compared to this healthy one. These pigment clumps cause the patient's field of view to be extremely obscured, as you can see here. Retinitis pigmentosa is degenerative, so the patient is born with a visual impairment that progressively worsens as they age. A disorder very closely related to retinitis pigmentosa that I will mention as I talk about gene therapy is Leber congenital amaurosis. Many experts consider Leber congenital amaurosis to be a much more severe form of retinitis pigmentosa. The patient is born with little vision that often fades within a few years. Now let's discuss gene therapy. There are several forms of gene therapy. One form is replacement. In this process, doctors remove a defective gene from the patient's chromosome and insert a healthy gene in its place. For example, the p53 gene typically prevents tumor growth. However, when it is defective, it can cause many types of cancer. If a malfunctioning p53 gene were to be replaced with a healthy one, doctors believe it would trigger the cancer cells to die. The most common form of gene therapy, and the one I will discuss the most in this presentation, is repairment. In this process, doctors find the defective gene in the patient's chromosome and attempt to repair it. Mutated genes that cause the disease could be deactivated, or healthy genes that fight the disease could be activated. The genes must be inserted using a vector, which carries the gene. What is CRISPR? CRISPR, or Clustered Regularly Interspaced Short Palindromic Repeats, is a newly invented gene editing tool that allows doctors to edit genes more easily and effectively. Earlier this year, it was used inside someone's body for the very first time to treat an inherited form of blindness. After the treatment, it could take up to a month to see if it was successful. When a patient has severe inherited blindness, such as Leber congenital amaurosis, the gene needed to cure their blindness is too large to fit into the vector. Therefore, it is not treatable with standard gene therapy. However, with CRISPR, doctors can now repair the mutated gene in the patient. The surgery is performed by cutting the gene on either side and deleting the mutated gene. Then, the strands on the end would reconnect and the gene would start functioning properly. The surgery lasts 1 hour and is done under general anesthesia. To insert CRISPR, 3 drops of fluid containing the gene editing machinery are dropped beneath the retina through a tube as wide as a hair. Once the cell is edited, it is permanent and will last for the life of the patient. Some possible risks that come with the procedure are an unwanted immune system reaction, targeting the wrong cells, an infection caused by the virus, which in this case CRISPR is the virus being used to transfer the genes, and a possibility of causing a tumor. However, the risk is very minimal, and companies that produce CRISPR have worked to eliminate the possibility of unintended alterations to other genes. Benefits of this procedure are widespread. The main benefit is that the patient that was formerly blind will be able to see. Doctors only need to correct 1/10 to 1/3 of the genes for the patient's vision to be restored. The treatment is government regulation approved as well. Blindness gene therapy is still not entirely safe as it has some side effects. It has only been tested on a few patients so far. The procedure is very costly and doctors do not have direct access to the resources. As it becomes worldwide, it may be limited to richer countries with well-developed healthcare systems. However, if more and more trials are successful, doctors hope to perform the procedure on more people to help cure blindness. Here's my big bibliography, and thank you for listening.